Welcome to the Chief Healthcare Officer podcast, where we delve into the dynamic world of healthcare leadership and innovation. I'm your host, Dr. Fatih Mehmet Gül, and today I have the pleasure of speaking with Greta Rosler, CEO at Radius Leaders and a renowned expert in nurse leader development. Greta's journey from bedside nursing to executive leadership and consultancy has been nothing short of inspiring. We will discuss the challenges and successes of nurse leadership strategies for retention and quality care, and the future of nursing in a constantly changing healthcare industry. Join us as we delve into the insights and recommendations of one of the most influential voices in nursing leadership. Greta, welcome and thanks for joining us today.
Thank you so much for having me.
Thank you. Today, when we look at the leadership issues within the healthcare, nursing comes at the top of all the rest of the important items. And that's why we just wanted to have this call with you. We want to know more about you, and we want to discuss today how we can improve the nursing leadership, your advices, and the challenges, and lots of things, I'm sure. So can you share with us your journey from bedside nursing to leadership and finally to consultancy? What motivated this journey?
Sure. Thank you so much. So I was a bedside nurse in a critical care setting and in a perioperative setting. And I transitioned into leadership because I was just looking for something that I could do in the off hours when my young children were asleep. So I became a nursing supervisor, and I quickly realized that I loved getting to solve problems for different staff. And through that, then someone recommended I become a manager. And so I led 3 different medical surgical units plus a wound care team for a large tertiary integrated academic medical center in the States. And that really showed me that nurse leaders are the center of everything that's happening in terms of creating patient outcomes. And that role then led me into a patient experience leadership role where I again realized the same thing, that all the services in the hospital were critical and nurse leaders were really driving the outcomes in the department, and it was really up to them to make it happen. So during that time, I also helped build and lead a nurse leader development program for my health system, and that is what really brought all of this together for me, that nurse leaders benefit so much from concentrated development with their peers and thinking about how to get that for them.
Amazing. Which hospitals have you been working for?
So I've worked for a variety of healthcare systems and hospitals. My background was with the Geisinger Health System. And then when I left Geisinger, I went to work for a company called the Academy of Communication in Healthcare, where I had the benefit of working with organizations all over the U.S. During that time, prior to that and during that time is when I began my own journey of helping nurse leaders, because again, I continued to see that there was so much opportunity for nurse leaders to really be centered in driving the outcomes of their organization. So I began many years ago, kind of just because people started asking me, hey, could you tell me how you did this in your departments, or could you help? I have a leader that needs help with this. And so I started that work about 6 years ago with UPMC. And then from there, I had some colleagues contact me from Temple Health in Philadelphia. And from there, I have worked at the Penn Medicine Health System. And then during that time, I've also begun to build programs that unite nurse leaders across the globe and nation virtually. So I've had leaders come to my programs, both longitudinal programs or single day programs from all over the place across the U.S.
Amazing experience. And thanks for sharing these renowned organizations. And I'm sure it was a great chance to see every single different type of leadership. I myself, I have worked with amazing chief nursing officers, but right now I feel myself very lucky that I'm working with a chief nursing officer today for almost 1,500 nurses she is managing. And the beauty with her, she was born in our hospital, and our hospital has an adjacent nursing college. She was graduated from this nursing college. Then later, she joined working in our hospital in 2012. And then she got the master from our nursing college afterwards. And now she is the chief nursing officer of the hospital where she was born. This is an amazing story. And I every day learn from Khadra, the way how she manages the nurses and she influences everyone. So I just had to share this and then thank to her, and I learn every day from her.
That's a lovely story, and what a gift it is that the CEO and leader is learning from the CNO, and that sort of dyadic relationship is so beneficial to everyone.
Indeed, indeed. And the last thing, last week we were discussing with her was about the nursing communication. Because when you have an admitted patient, the first thing is the communication, where you have to set the expectation and you have to introduce yourself. And then the patient and nurse relationship will start at this level. But if you don't introduce yourself, it's quite difficult for the patient to know who you are, and then your expectations and other rules and regulations in this room. And we also know this very well. Doctors, technicians, and others definitely, I mean, they come in and visit the room, but the room our rooms are mainly occupied and managed by the nurses. If the doctors, they come and visit for an hour together with technicians and the others, nurses visit this room within 20 hours period. So then there is a seamless collaboration and communication. That's why our patients, when you ask them, the first thing they will know the nurse's name, and we want to influence this within our nursing management. So if I may ask you, in your experience, what are the most significant challenges that frontline nurse leaders face today, especially in the context of the current healthcare landscape?
Well, Dr. Fatah, before I answer that question, I just want to acknowledge something you just said, which is that if the patients know the nurse's name, your nursing teams are doing something very right, because it's not just as simple as telling the patient their name, because the patient sees so many people. So that means to me that the nurses are making a very good impression and doing specific things to connect themselves to those patients. So hats off to your team. Way to go. But back to your question. So, what are some of the most significant challenges that nurse leaders face today? Well, obviously, the whole world knows that we are resource constrained in nursing. There are not enough nurses to go around globally. And there's not been an easy fix for that problem. So I think that is probably the biggest challenge we're facing, is that nurses are not plentiful, and a lot of the nurses that we do have told us with a variety of surveys and statistics that they're not interested in staying in nursing, and they're not interested in moving into nursing leadership. Very few nurses, if I think in the US, there's a figure about 4 million nurses. And out of those, I read a statistic the other day that said only 11% were considering leadership. So one of the bigger challenges that nurse leaders have is not only retaining their staff, but building a bench of qualified leaders to work with them.
I hear you, and then I feel and then live in this every day. Myself, I have been running hospitals for more than 20 years in the Middle East, and where we need to import nurses and we need to bring nurses from other countries. We have been working in some other countries before, and now the nationality mix has been shifted, and the previous resources are not available anymore. And today we're looking for other countries to bring the nurses. And you know what I have noticed? If you continue to bring nurses from different countries, you certainly see the differences between the schools of nursing, and you can see differences in the practices. And that's why whenever they come, we give at least 1 month orientation, and we let them see the patient, touch the patient a month after they're joining, in order to make sure that they have got enough orientation and they can work with us. Resource is a huge issue. Yes, I mean, small number wants to go to the nursing leadership. But on top of that, when we look at the 2030, I think we're going to have a global nursing crisis, which will be a big hit to the healthcare market.
Absolutely. We are amidst the crisis, and the crisis was happening prior to the pandemic, but the pandemic really magnified where we were headed anyway. And many nurses have left the field of nursing because it's very difficult. The historically, nursing has been under supported in many organizations from the standpoint of the infrastructure around them, the pay, the ratios, all these political dynamics and other dynamics of the infrastructure of nursing. So we're going to continue to face this. So one of the things that when nurse leaders are challenged by this ongoing turnover and attrition issue, what we also know to be true, however, though this is a global crisis, what we know to be true is that nurses are likely to be retained when their leader has certain attributes, and when their leader expresses authentic relational leadership, and when their leader has a high presence that's very intentional and strategic. Then nurses, the data shows us, nurses are retained and are likely to stay. But without that, nurses are leaving. And so we're having to create a shift and kind of shift the narrative that this isn't just post-pandemic attrition continuing. This is cited as toxic workplace culture. This is cited as lack of being heard. It's cited as lack of organizational support. So nurse leaders have that challenge to bear as well.
I totally agree. Today, many of us, we talk about the competition in healthcare business, and you also have a very tough competition landscape over there in the US. And I think within the competition, many of the leaders, they simply look at the financials and the others. That is definitely an important thing. But before that, it comes about leadership. If the leader listens, if the leader creates the connection, especially with the nursing team, they simply want to be listened, and then definitely they want the engagement. And with this way, you can definitely create a better environment, and you can compete on this. This is what I believe could be the right thing for our peers. So given the talent shortage in nursing, how can healthcare organizations maintain the high standards of nursing quality without overburdening their staff?
Well, it will be impossible to continue to give great quality without the right resources. And, however, I think, and I've observed this over and over again in my work, and it's very present in the data and just in talking with and working with individuals across the nation and the globe. The key to creating high quality healthcare and high quality outcomes without burdening the staff more is leadership presence, which that doesn't sound like rocket science, but what it really takes is intentional presence. So a lot of the work that I do centers on leader rounding as sort of the tipping point for leaders to start to shift the culture in their department, with their teams, or their organization. And intentional leader rounding that is strategic, that is efficient, because a lot of the reasons people don't want to round is because it takes a long time, and that's understandable. So that says to me, we need to help them with efficiency while still being empathetic. But leader rounding on patients and staff in a way that is intentional, authentic, and strategic. That's how leaders can start to shift a culture, because only when they're really out there with intention. And I don't just mean the celebratory rounds where leaders go around and hand out cupcakes and gifts and see night shift and all of that. That is all terrific. And what I'm really talking about are patient rounds that focus on priorities of the hospital, so leaders can hear those priorities directly from the patients. And then leaders can take action on the gaps in patient care. And then rounding on staff with a lot of intentionality around, what are we doing for you? How can we do better for you? What do you need in order to do your job better? And those questions have long been kind of the tried and true leader to staff rounding questions. But when you can do that intentionally with the right follow-up coupled with leader patient rounds, that's how you shift the culture and keep or improve your outcomes.
I totally agree with you. I mean, why do we need the quality, and then why do we need all these improvements? We just want to offer better service for our patients. And then within this, we always need some initiatives, where to improve, how to improve. And we don't need to create such things from our room. If we just have the rounds, our nurses are ready to share. They're just waiting someone to listen them. They're waiting someone to ask them. So then when you visit, definitely they will tell you which projects are required and what our patients are looking for. And if you implement those things, okay, I mean, you will be the best hospital and you will have the best nursing quality and without overburdening your staff. So my hospital is a magnet recognized hospital, which helps us to work on the healthcare leadership transformation. And then also it requires involvement of every single level of nursing within the daily operation. And you know how difficult it is from US, and outside the US there are very few hospitals actually who was bravely enough to get into this. And our nurses, they showed that one, and then they keep inspiring me every day. So I totally agree with you. We need to spend some time, but quality time together with them, and we need to simply listen them. So if we look at your company, the Radius leaders, and then you meet with the leadership teams and the others, can you just give us an example of a unique project or the program that has been particularly successful?
Sure. So the way we work with organizations is really focused on practical skill development. So that sets us apart from other or consultancies, and I like to call us a partnership company because we really become partners with the organizations we work with. But our goal is to develop practical skills through showing up in the spaces where nurse leaders are actually working. While we do, for instance, our skilled nurse leader program is a series of 6 to 8 workshops that focus on building tangible skills for leader rounding, the follow-up conversations that go with them, and the building a culture of accountability and ownership within your team while avoiding alienating them, but instead engaging them. So our skilled nurse leader program works on that and shifts outcomes. And we've seen this happen for a number of departments that we've worked with, both in Temple Health and also for some of my virtual programs that we run. And what we also really see is that nurse leaders are less likely to leave their roles because they finally feel like, I got support, I have someone to call upon, lean upon, and learn from. And we actually go out in the department with them, we round with them, we do rounding coaching right in the department with them, because that's really where the learning happens. We do teach them in a classroom first, but the learning really happens in the department. And so that, whether it's our skilled nurse leader program or our own year rounds program, that's a pivotal part of it.
Can you give us any sample projects so far, which was something important? Then you can tell us the impact of this.
Sure. So over the past few years, when I was working with the Temple Health system, we were able to see improvements in patient experience and quality outcomes such as falls, infection rates, and also, as I mentioned, nurse leader attrition decreased and basically stopped because nurse leaders were feeling like they got the support they need. So we saw, with intentional strategic rounding and upskilling those nurse leaders, we saw their patient experience scores improve across just a few quarters. It didn't take long for it to happen. Once we gave them the right skills and helped them understand how to round for impact and efficiency, there were multiple departments. And I mean, these were high turnover, high volume departments with lots of staff challenges, patient challenges, physician challenges, you name it. And we were able to see their patient perceptions improve as well as their quality improve.
Beautiful, beautiful. I mean, hearing the combination and the blend of nursing services and then patient experience, I think this is what we need to see in all our wards, in all our operation. And your background definitely supports this on the ground. So if we just, look at the structure, how do you think the nurses could collaborate in the best way with the patient experience teams?
Well, I think it starts with the patient experienced teams finding the nurses where they are. Many times they're viewed in these sort of separate worlds. And for a patient experience team to really help and support nursing, it requires that they go where the nurses are delivering care. And that sounds very obvious. And yet there's many organizations where their leaders are coming to me because there's this sort of disconnect between patient experience improvement and nursing. But the best patient experience leaders will realize that one of the primary keys to their success is nursing leadership. So patient experience leaders meeting nurses where they are, literally, and then rounding with them, and then getting a handle on not only the feedback that they're hearing from rounds, but getting a handle on what the nurse leaders' challenges are with understanding the data and how they can make sense of it and actually use it for improvement. And when a patient experience professional or leader can do that at the front line with not only the leadership team, but the staff, then it all starts to come together, and staff start to realize they are not expecting me to be perfect. And there are a few things I can do to just change my language or change how I support a patient that won't add any more time and will actually make all of our lives easier.
Wow, wow, great advice, great advice. I mean, having the round together and knowing where the nurses are, I think are the main points. Since I have you, I definitely have to touch also to the digital part. I myself, I worked with Roland Board, nurse call system, and then I worked with several others. Now Hillrom is getting into, and there are several nursing solutions where you can, I mean, hang to your neck. There's something over there. You can communicate with the other service providers over there. So how do you see the digital health and then the technology element supporting the nurse leadership?
We have to acknowledge the presence of technology and all of the gifts it brings to us in terms of being able to communicate virtually with patients and staff, and between patients and nurses, virtual nursing, and home health and hospital at home now, all totally changing the landscape. I think we're foolish if we don't think we have to acknowledge the space for that. I think there's tremendous opportunity for AI to impact how nurses document and relieve some of that burden for them. And as we look at the staffing and retention crisis, we have to start thinking about how technology can be our friend there and relieve some of the burden that frontline nurses feel today. With that being said, I believe that there is nothing that will ever replace the nurse and patient human connection. And while that can happen virtually, or there can be things that will augment that connection, the likelihood of a patient healing in the same way is lower. And we know that to be true. So I think we should head into this new world of technology, AI, VR, all of it, with caution and hope.
Well, I can't agree more. Technology is an enabler, nothing else. And definitely today or 100 years later or 200 years later, people will look at the nurses holding their hand. And there is no substitute to this one. And then definitely we need to bring the technology to help us assisting our work, documentation, decision-making process, and then order management and the others. Nurses have too many tasks, but definitely technology is an enabler. So what advice would you give to new nurse leaders who are stepping into their roles in these challenging times?
I would say that any new nurse leader should attempt to prioritize as much time as possible in their department with their staff and with their patients. And many new nurse leaders will share with me almost every day. I hear this, the abundance or overabundance of meetings that they're required to attend and other tasks they're required to do that take their attention away from the staff and patients. And that's no fault of their own. It's the broken system where a lot of that needs to be relieved from them. And I always encourage nurse leaders to do whatever it takes to prioritize that time with their department, in their department with their team, and not just out running around. I like to call it the moth effect, when nurse leaders run around in their department and are doing everything under the sun to help their team, and yet maybe not accomplishing the actual act of leadership. So finding ways to strategically be present through rounding, through attendance at staff huddles, and that gives them an opportunity to role model the communication they want to see, the behaviors they want to see. And it also gives them an opportunity to observe where their support as a leader would be best utilized. So any new nurse leader, if you're listening, find whatever way you can to spend intentional strategic time in your department. And if you can't find it, talk to your leader about that challenge and see what you can come up with together.
Beautiful, beautiful. I mean, definitely supervisors, directors are very important. We are seeing the CNOs, and now we have started seeing the hospital director or hospital CEO coming from the nursing background. So from your extensive experience, what has been the most rewarding aspect of working with nurse leaders and healthcare executives?
The most rewarding thing for me is always to know that when I watch a nurse leader gain skills, it literally is a visible change to see a nurse leader get just a few skills that provide them efficiency with rounding and their conversations with staff. And it turns from a burden to something that they actually feel equipped to do and confident about. And so the biggest gift for me is being able to contribute to that gift for nurse leaders, and then watching them flourish and change the care for the humans they're delivering it to, whether it's their staff or their patients. I am so proud when a nurse leader that I've been able to partner with achieves wonderful things in their department, and their quality improves and their turnover decreases, all because of just how they shifted their own approach to leadership. That's what fulfills me.
Amazing, amazing. And definitely, I mean, as I said at the beginning, for me, walking together with the nurse leaders, having my executive round together with them is always a joyful event and a learning time for me. I learn from them, and we just knock the patient room door, and then we enter to the room, and I just look at how they communicate. And in between, I also introduce myself, saying that I'm just the member of this team. If there's anything we can help. And when the patients, they see this collaboration together with nurses and then the management of the hospital, it definitely brings another kind of spirit into the room. And then you can see different kind of engagement from the patient side. And this gives an energy to us, our patients. And every day I try to make this one, and it is something I love. So it was a wonderful talk, Greta. I really appreciate. So finally, what is one key message you would like to leave with our listeners, especially those in nursing leadership roles?
One key message, I think, is nurse leaders, if any nurse leaders are listening, or leaders that support nurse leaders, as nurse leaders, our greatest purpose is to serve those around us. And if it's not patients, then as a nurse leader, it's our team members. And so getting very clear on how to fulfill that purpose every day is central to what you do in your success. So remember that. What is your purpose every day, and how can you fulfill it through your activities and on any given day?
That's beautiful message. I think we learn commitment from our nurses and nurse leaders. We learn resilience from their side. We learn agility from our nurses every day. And it's always, influential to spend time with them. So thank you, Greta, for the insights you have shared with our audience today. To our listeners, please leave us a comment if this episode sparked your interest, and stay tuned for more amazing healthcare talks.